Dr. Amanam, the JAK inhibitor class of therapies often have side effects associated with them. What advancements are being made to manage these side effects?
Yeah, it's a great question. And I think I would think about when these JAK inhibitors first came out, I think we were all willing to accept the side effects because of the fact that we only had one JAK inhibitor. And then we now have more than one. We have a couple of JAK inhibitors. And I think the idea is that the biggest problem that we had with some of the JAK inhibitors were that patients' counts couldn't tolerate higher doses of the JAK inhibitor. And and we know that for some JAK inhibitors, you have to be at a baseline dose that will help with shrinking your spleen or improving symptoms. And if you're below that dose, it doesn't work very well. And so we had a tough time making adjustments based off of patients' counts. And so we have some newer JAK inhibitors that patients tolerate these drugs even though they have lower counts. And so I think that's one big change that we've all seen over the past 5 years.
Is there anything else you'd like to add about advancements in myelofibrosis care?
I would say if we think about early stage, a patient who's diagnosed and they're told that they're early myelofibrosis, or what we really truly define as low risk myelofibrosis, we traditionally did not have any therapies for those patients. And I think that it's exciting that we are in a space now where we are thinking about therapies for those patients and therapies that will reduce the risk of progression to a more advanced stage of myelofibrosis. For patients who are in the middle, I think we've had a rapid expansion of the therapies that are available to patients. And I think a lot of our clinical trials that are currently in play are really directed towards that group. And so that's really exciting. And then for the high-risk patients, City of Hope is a bone marrow transplant center, cellular therapy center, and we have a lot of experience in performing allogeneic stem cell transplants for myelofibrosis patients. And I think across the country, we have gotten better at performing allogeneic stem cell transplants for myelofibrosis. And as of right now, it's one of the few curative therapies that we have. And we have been able to understand how to get these patients through a very intense regimen and get them to the other side. And I think that's also very exciting. We still have a lot of clinical trials in the allogeneic stem cell transplant space as well. And so I think we are in a place now where we have a therapy for everyone if a patient may choose to want one. And not only a therapy just to bridge them or treat their symptoms, but therapies that potentially will get rid of this disease. And I think for a patient, when you go to sleep at night or when you talk with your family, the biggest worry is having something that there's no clear sense if we can get rid of it. And I think we're getting to a better place where I can confidently tell patients we're getting better at getting rid of this. And I think that's the most exciting thing that we have right now.
Yeah, it's a promising field.
Very promising.
If we look at care and treatment, why should a patient with myelofibrosis consider a second opinion with a specialist?
The field is rapidly changing, and we have very few FDA-approved therapies, even in 2024, for myeloproliferative disorders and myelofibrosis. And because of some of the changes in understanding of the biology of this disease, I think that there are many patients that will benefit from physician or a center that specializes in treating patients with this very rare disorder. And I believe that even though we have very few FDA-approved therapies, I do believe that we can give patients an opportunity to get this type of disorder under control and actually offer curative approaches that may not be available to all facilities.